Hi guys, good morning and welcome to another MA session with Dr. Ben. I'm Dr. Ben Behnam, co-founder of Happy Ed, here with the rest of the team in our Happy Ed office in West Los Angeles. So guys, welcome. Today's topic is going to be doing a combination of topical Happy Ed along with oral medications. So Happy Ed is a customizable product that contains finasteride, minoxidil, and retinoic acid. It's based on clinical studies, and doing it alone by itself, actually, we've seen that patients see amazing results. Now, there are some patients that both on Happy Ed and in my own personal clinic, we actually do what we call sandwiching. So we have them do the topical finasteride, and they also go on oral medication, either being finasteride or minoxidil. We've noticed that basically those patients that when they do both together, they see amazing results. And the reason is because you're applying the topical finasteride and taking orally as well. So as long as you don't have any side effects, doing both together is okay. We just don't want patients to start both simultaneously. So what a lot of patients do, basically, a lot of patients that come to us that have already been on oral finasteride, so they'll just continue that and add topical finasteride to it, or they'll start with topical Happy Ed, do it for about 3 months, and then basically start oral, they add oral onto it again. So that being said, we're going to start with our questions. So I've had significant hair growth after applying Happy Ed twice a day for the last 14 weeks. Is it okay for me to change to once a day application? So thanks so much for that question. Everyone's is different. There are some patients that once they go to once a day, they lose some of that growth. And there's some patients that when they go to once a day, they don't lose that growth. So I think it's hard to really judge it and to really say it. So my recommendation is that we typically have patients on it for 6 months twice a day, and after 6 months, if you want to go down to once a day, that's fine. But it really depends on how you're going to respond. So I can't really answer that question. How long does it take before I start seeing results? I'm losing my hair around the crown of my head. I've been using Habit for a few months now. So, so again, it typically takes about 4 to 6 months. My recommendation also is to take photos on a monthly basis so you could track it, because what we've seen in the office is that it's called the pregnancy paradox. Sometimes you have the hair growing out, but you don't see it because you look at yourself every day. Because when your wife is pregnant, you look at her every day. You don't see her getting bigger and bigger.
Oh, but so you don't notice the change yourself.
Yeah, the change, exactly. Yes, that's right. So it's the same. That's what it's called, the pregnancy paradox. Yes, has nothing to do with pregnancy, but yeah. So the key is basically to take photos so you can monitor it, but it really does take 4 to 6 months. And also, just like oral, look, there are some patients that may not respond. So let's say if you're doing it for 6 months and you don't really responding, then at that time it might be a good idea to add an oral medication, not substitute, but add on an oral medication, either oral finasteride, minoxidil, or imidutasteride, to see if you're going to get a little more of a robust result. Thank you so much for that question. Still losing a lot of hair, long pieces from the hairline and sides. Been on for 6 weeks. 6 weeks. This is 6 weeks. It's normal to be losing hair. You could lose hair up to about 8 to 10 weeks initially. It is due to the minoxidil. Typically, if you're losing hair beyond the 8 weeks or 10 weeks, then we'll take out the minoxidil from the formula. You can always reach out to us and we'll be more than happy to do that for you. Thank you so much for the question. What are some of the cons of taking both topical and oral medication? There's really no cons. I mean, you have to realize there's some patients that have been on oral medication for a long time and has basically plateaued. So sometimes adding a topical medication basically will re-stimulate some of the hair growth. So, and everyone's different. And it really depends where you are at your life stage and how aggressive you want to be with hair growth. There's some patients that want to be very aggressive. And again, I'm not recommending this for everyone, but I have some patients in my own personal practice that, they were 25, losing hair really aggressively, went on topical, and then went on both oral minoxidil and oral finasteride. So doing 3 things in one. And it was only doing all that we were able to really just calm down the hair loss. So remember, results varies amongst patients and everyone's different. So, but doing topical oral medication, could certainly be an option for certain patients. And if you feel that using a topical and you want to see better results, you can certainly add the oral. Just reach out to us at Help and Happy Head, and we'll be more than happy basically to help you find that answer. Is there any evidence that minoxidil, finasteride, and finasteride absorb better when delivered using propylene glycol versus water? No, there is no evidence. First of all, you have to realize that basically it is it's even in the aqueous formula, in the water-based formula, there's still some alcohol in there basically that's allowing these ingredients to dissolve. So, but there's really no evidence that the propylene glycol is necessarily better basically than water. Um, Somebody asked a similar question yesterday.
Can you talk about our new water-based formula and why that's
Yeah, so the water-based formula, it's 80% basically. So first, it's made by the base is actually made by a third-party company, which basically is all they do is hair loss. They do a lot of hair, and it's about 80% botanical material and 20% alcohol, and the material still dissolves in the alcohol. So the reason why we can't do all water-based is can't be 100% water-based, because then yes, at that point none of the ingredients are going to dissolve, then you're not going to have much absorption. But as long as the ingredients are being dissolved in the material in the solution, then you're good to go and it will get absorbed. What is the purpose of retinoic acid in the formula? So there are clinical studies that show that when you add retinoic acid to the minoxidil, it increases the absorption of the minoxidil. So that's the purpose of it, just basically better efficacy for the minoxidil based on clinical studies done by third parties. Can I tell you more about the benefits of Derma roller? So Derma roller is a roller that has about 540 spikes. I'm not sure if we have any here. 540 spikes at the tip, and they come in different depths. So you have the 0.5 depth. Here we go. So here's the Derma roller. Here's the Happy Head Derma roller. Here we go, guys. Let's open it up. Let's look at it. Yep, here we go. Nice and fancy. It says Happy Head on it. I love it. So this is the 0.25. So the way it works is that typically we like to use them when the hair is wet. So typically we encourage our patients to apply Happy at first and then gently roll. Guys, the key word is gentle. You see, I'm gentle. I'm not putting a lot of pressure on it. It's basically the same pressure that you want to apply when you apply your deodorant. So very gentle. Basically go back and forth, left and right, up and down. You're not going to bleed. You're just going to be very gentle. Do it for about a minute. The whole point is that it punctures the skin. So, and that does two things. One, it creates tiny holes. So when you basically the Happy Head gets absorbed better into the skin. So you have better penetration, better results. And number two, when you basically go back and forth, is increasing the blood flow to the scalp. And as a result, you're going to have more blood flow, better nutrients coming in, just more hair growth. And there are some studies where patients actually just did the Happy Head Derma roller by itself, and and actually they had hair growth.
what size would you?
0.25. So the Happy Head Derma roller is 0.25. Yeah, and it says it on it, 0.25.
Would bigger needles mean better?
Bigger needles means it's gonna hurt more. That's
So
what it
not
means.
necessarily.
Look, I think that's questionable. I know there are a lot of studies, like a lot of people out there on YouTube saying, "Oh my God, do the 1.5 once a week." It just hurts. So our recommendation is do the 0.25 and do it every night. Are headaches common side effects of any medication used by Happy Head and other hair loss? The headache is caused by the minoxidil. So minoxidil causes, headaches, initial hair shedding, irritation on the scalp, heart palpitations.
Is it possible for these to come on after years of treatment?
Typically not. Typically happens right away. The headaches usually goes away after several weeks. But if you're getting these pounding headaches, then you should stop the medication. But again, any form of minoxidil, either from us or our competitors, or Rogaine over the counter or the Kirkland formula, it's all the same product. So it's just the fact that the Happy Head minoxidil is prescription grade and is 8%. But it doesn't necessarily mean you're going to have more headaches. Headache just happens with the over-the-counter versions.
So say a patient is on finasteride for at least a year and then slowly starts to notice more depression, anxiety symptoms.
You should stop. If you're ever getting any depression, anxiety symptoms, you should stop the medication right away.
And then how long would they expect for those symptoms to go away?
It should usually go away right away once you stop. Like there's some side effects that are tolerable and side effects that are not tolerable. So getting a slight headache, some slight irritation, we're fine in it. But if you're having anxiety, depression from the product, you should definitely stop. And that could happen with both the oral and topical, but they're very rare. I'll tell you, I've been doing this for over 15 years, and I probably only had 3 patients in my entire lifetime with side effects of depression from oral finasteride. And I've actually never had it with topical finasteride at all. I don't think we've ever seen it.
So could it be something that you develop a sensitivity towards it?
I don't think it's causing development. So some people are just really sensitive to it.
Really sensitive, okay.
So where should I start if I've never taken finasteride or minoxidil? I think you should start with the topical Happy Head and see how you do, because the Happy Head has finasteride and minoxidil in it. Again, this is a customizable product, and one of my patients was asking this morning, what does it mean customizable? What it means is that, let's say you're getting a lot of irritation from the minoxidil, you let us know, and we're going to switch out. We either lower the concentration of minoxidil, or take it out completely, or reduce the retinoic acid concentration, or take it out, or switch it to the aqueous formula. So there's a lot that we could do. We'll switch it out and we'll send it to you. We understand that not everyone is the same. People are different from one another, and as well, results varies and side effect varies. So that's why our product is customizable to basically match your needs. Are there any beneficial supplements that can boost results? Yes, the Happy Head multivitamin contains collagen, saw palmetto, keratin, and high dose, I think it's 2,000 vitamin D, and it's actually very beneficial basically to do the two together. So if you want, definitely just reach out to us and we'll send you guys the link. Is hair splitting after long-term treatment? I don't understand the question.
Yeah, so I suppose it could be like long-term use of like an alcohol base or something that strong. Could that potentially, or could
Cause the hair splitting?
Factors?
Not typically, no.
So it wouldn't be related to Happy Head.
No, it's not related to Happy Head. I mean, you could get dry from Happy Head and irritated from the minoxidil. If that happens, definitely let us know. And also, there's a special serum that we have that we could send you. So just let us know. Again, if you're having irritation from the product, just give us a heads up. I think oral dutasteride has a very long half-life. So will it take a long time to get out of your system, correct? Yes. So dutasteride has 5 weeks half-life, and what that means is that if you were to take it orally, for the product to go back to 50% is about like 5 weeks. Yes, and it's longer to get out of the system. That being said, in the clinical studies that were done, comparing oral finasteride to oral dutasteride, the side effects of the two really didn't change that much. So, like, there was no noticeable increase in side effects with dutasteride, and there was no noticeable lengthening of that side effect. So it seemed pretty much the same, although dutasteride does have a longer half-life. Can you use a laser while using Happy Head? Yes, absolutely. There's no problem with using laser. You could definitely do it. What percent of cases in your clinic show improvement when you add Happy Head after using oral finasteride and topical minoxidil for many years? Good question. I don't have an exact stat on it, but I'm telling you, patients come in and they're amazed by the results. Just because they've been on the oral finasteride, the body has gotten used to it. So when they add topical finasteride and minoxidil, they all since like see a boost. You're just sitting on fire, they see a boost. So it's a significant portion, again, but I just don't have an exact number.
Okay. Would going back to finasteride after switching to dutasteride still work?
Yes, it will work, yes. So in the clinical studies of finasteride versus dutasteride did better overall, but there are some patients that for some reason do not respond to dutasteride. You don't know why, but I had another patient this morning who had used dutasteride from another doctor, and I think it just didn't work. So yes, you could just go back to oral finasteride and you'll be fine.
Okay. And then how how would they know what type of oral to add?
Yes, so you necessarily wouldn't know. I mean, typically you have to talk to one of our doctors to really figure it out. But again, there's typically oral finasteride and oral minoxidil. It depends what the threshold is for the sexual side effects. If you don't want to use anything that has risk of sexual side effects, then it's better to go with oral minoxidil. If you kind of like don't care, or basically, we all know the risk is very low, like 2 to 4%, then then going with the don't go finasteride would be fine. Just ask our doctors and we'll let you know. Now, what is the kitchen sink? The kitchen sink is finasteride with dutasteride combined together. That's the kitchen sink. And look, there's some patients that use it, and they see really good results. So that's the kitchen sink. What other products does Happy Head offer? Great question. So we have, okay, we'll bring some out. We have our Derma roller. We also have our Happy Head multivitamin. It has been released, but I'm not sure if it's on our website yet. We also have our Happy Head shampoo and conditioner. So I use the shampoo and conditioner all the time, and I've replaced my regular vitamin that I was taking, the Flintstone vitamins that I was taking, with the Happy Head vitamin, because now I don't have to take additional vitamin D, and I don't have to take additional collagen because it's already all in here. So, and here is our Happy Head shampoo, which basically has argan oil, biotin, saw palmetto, collagen, and keratin, and also we have our Happy Head conditioner, which also has the same things as well. And if you want any of them, just send us an email, help@happyhead.com, and we'll send you the link. I'm losing my hair while using Happy Head initially. When should I be concerned? Basically, after the 8 weeks. Because it's normal to lose your hair initially. It is due to the minoxidil.
Would you say all side effects should show up in the first month of use or the second month?
Majority of side effects usually appear in the first 2 months. Again, the side effects typically include, just irritation, dry scalp, flakiness. That's from the minoxidil. Also, you have like the initial hair loss that could happen from the minoxidil as well. So again, the two components, minoxidil and finasteride, were actually three. Minoxidil, finasteride, retinoic acid. Is the minoxidil that has the most amount of side effects we see. The irritations, the flakiness, heart palpitations, the headache, the initial hair loss. Finasteride, believe it or not, is a very inert drug. The main key by the finasteride is the sexual side effect, which is actually pretty rare on the topical, and the risk of anxiety, depression, which again is very rare as well. How long before you get a Happy Head cap? I mentioned this over the weekend to our CEO. He's working on it.
Give us a quarter or two.
Trying to figure out what
we're working on it. Why an oil and not a spray? I mean, why a serum and not a spray? So that's a very good question. So initially, when we were testing a Happy Head, almost 5 years ago now, we initially had as a spray. There are a couple problems with the spray. Number one, patients, it's very hard to determine exactly how many sprays you have to do to be equivalent to like 1 ml. Like sometimes you have to do 20 to 25 times. And I think it's going to give you like trigger finger. Number two, the problem with the spray is that the minoxidil plugs up the tip of the spray sometimes. So after like a week or two, the bottle just stops working. So it's quite annoying. I think, and also number three, with the spray, the biggest problem we had was that it gets stuck on the hair on the outside, especially with people with long hair. So that's where the dropper is easy. You put on your scalp and you just basically just apply the dropper and rub it in. It's just much, much easier to apply. Trust me, a lot of this went through a lot of trial and testing years ago. So this is why the product it is the way it is. How much should patients be applying? Are there different recommended doses for different types of hair loss? That's honestly a really good question. Actually, we really don't see this question that much often, but it's a great question. So you're right. Everyone's different. According to clinical studies, is actually 1 ml twice a day. Now, some patients have a much bigger area of hair loss, and they may want to use it more, which is fine. You could do like 1.5 ml, but the problem is one, you're going to run through the product sooner. And number two, I don't recommend using 1.5 ml twice a day because I think you're just going to increase your side effects profile. So we really like to keep it at 1 ml twice a day. If you're going to use it once a day, you could use it 1.5 ml basically at night.
Okay. And then this question is just basically, it's a marathon, not a sprint.
Yes.
Mhm.
So how long does the results last if patient stops treatment? With any hair loss product, not just us, any company out there, any hair loss product, if you stop using it, you're gonna stop seeing the results within the next 3 to 6 months. That's also true with the oral finasteride, oral dutasteride, oral minoxidil. So it takes about 3 to 6 months, and you're gonna stop seeing the results, which means you're gonna start to lose your hair. Again, unfortunately. I mean, that's just how the products are. Is not we didn't make it like that. That's how they work.
Because they work by resetting the hair growth
The
cycle?
yeah, exactly. Yeah. So basically, here's the thing: your body's producing testosterone on a daily basis, so you're at a constant war. So if you're not gonna fight back, your body's gonna win that war. I mean, as simple as that. What is the best way to maintain hair transplant results? Can Happy Head help? Yes, absolutely. We put everyone in our office that does hair transplant on Happy Head. Basically, you could use it about after 4 to 6 weeks of your hair transplant. See, because what happens with hair transplant is that let's say you do transplant the front, but your body is still continuing to basically break down the other hair, the rest of your hair. So you still need to be on something to prevent the additional hair loss. Otherwise, you're getting another hair transplant in 2 years.
And then how much would you say would you use our standard treatment, which can be a little bit more harsh?
Yeah.
Or would you
Yeah, no, I would just use the standard formula.
like spaced out, or just the recommended twice a
Just
day?
to recommend twice a day. Now, so Happy Head is a customizable formula. We do recommend using it along with a derma roller. I think you're going to see better results. The derma roller that we have is a 0.25 derma roller, and you can still get one from Happy Head. Is that correct, Eric? Getting one from Happy Head, the derma roller?
Yeah.
Yes. They have to request it.
We've been sending you with all orders.
Oh, I see. Yeah. So, guys, you guys should have been receiving this with all the orders, which is giving out for free to everyone. Started last week. So you will be receiving it basically in the mail. So when you apply the Happy Head product, just basically gently derma roll, and we typically recommend the derma roll once a day, whereas Happy Head is twice a day. The other thing is our basically multivitamin. Eric, what's the status with our multivitamin?
Give us a month.
Give us a month. Are they also gonna be getting it with every order? No. I'm so sorry, guys. I tried, everyone. But the boss here says no. But maybe we could have a special promotion for people that come. Yes, we're gonna be having a special promotion for the multivitamin. Our multivitamin is taken. It's 4 capsules a day. It's very similar to one of our competitors that we're not gonna mention names, but ours is better because we have more collagen in it. And also we have more biotin in it. So our biotin is basically a lot more, which is great for your hair. So, and also you guys should have been receiving the sachets for our conditioner and shampoos. They do help quite a bit as well because they have biotin. It's basically like a biotin collagen shampoo for the hair. Really, that's what it is. Are there any hair follicles that are pre-programmed to have a limited lifespan? That's a really good question. It's not the fact that they're pre-programmed, like telomeres for your cell in your body, but what it is that your testosterone, they're sensitive. They're pre-programmed to be sensitive to testosterone. As a result, they die very quickly because of that testosterone. So they are pre-programmed to be more sensitive, not necessarily to have a limited lifespan. Because let's say if that cell was pre-programmed to be very sensitive, the hair follicle, but lived on a different someone else's scalp, someone else's body that didn't have a lot of testosterone, then the result would be different.
Can you explain why testosterone is the cause of hair loss?
Yeah. So the way testosterone works is that basically it binds to your hair follicles, and testosterone basically gets converted to dihydrotestosterone, and it's a DHT that causes miniaturization of your hair follicles. So what a lot of these serums do, like finasteride, dutasteride, there are 5-alpha reductase inhibitors, which means they block testosterone from being converted to DHT. And by not having a lot of DHT, as a result, you prevent that miniaturization, and a lot of times you reverse that miniaturization. So will finasteride alone help with the hair miniaturization? Yes. it could help with the hair moisturization, but you have to realize that there are many reasons why people lose their hair. It's not just testosterone; it's also the lack of blood flow to your scalp, and this is why we have minoxidil in it as well. So you have minoxidil, which is a vasodilator, is bringing more blood to your hairline, to your scalp, and then you have finasteride, which is a DHT blocker. So it's the two combined together that patients see better results. How can patients order Happiest shampoo and conditioner? Eric, is it on our website yet?
Yeah, I just shared the link on the chat.
Oh, yeah, here we go. Eric just shared the link on our chat.
You can also reach out to help at Happy Head.
Yes, you can also, for any of these products, you can also reach out to Help at Happy Head, and we'll basically send you the exact links.
Oh, and then one more thing to mention is that the shampoos are available without subscription as well.
Okay, so the shampoos are available without subscription, so you could just buy it as, one-time purchase. So, and you should also be getting the sachets. Sorry, I unclicked that. So the question was, how is Happy Head different from Keeps, Him, and Roman? So great question. So Keeps, Hims, and Roman, they mainly focus on oral finasteride. Happy Head is topical finasteride mixed with minoxidil and retinoic acid. So we are topical and they're oral. We truly believe that the topical has lower risk of side effects. And also you're applying it where you need it. When you take oral, one, you're having a systemic absorption, you're increasing your side effects, and it has to first go through different organs, kidney, liver. So by the time it gets this to your scalp, this is a much lower percentage. So that's the real difference between us. Now, Keeps and Hims do have topical Rogaine. Topical Rogaine is not prescription, but ours is prescription grade. Hims also has their topical finasteride as well. The difference is that their product has finasteride with minoxidil, but ours is a higher dose of minoxidil, and ours has a third ingredient, which is basically retinoic acid. Also, our Happy product is customizable. So their product is not customizable, whereas ours is. So let's say if you have an issue with any of the ingredients, you let us know. We take out that ingredient for you and ship out a new one. So our product is not being sit on the shelf for many, many months. Our product is customizable. It's literally made just for you, so you could ship it, so you could change it as you wish. That's how we're different. And we also have a great support staff, so I think that makes us superior. Why do hair follicles become more sensitive when we age if testosterone level declines? It's not the fact they become more sensitive, it's the fact that, certain hair follicles have a certain sensitivity that's always been there. It just takes really a while, basically, before they become miniaturized. So, that's the reason why. It's not, they've always been the same sensitivity. It just takes a while before they become miniaturized. It takes years. Well, guys, thank you so much for all the questions. Again, please feel free to leave us a review on Facebook or Trustpilot. We really appreciate it. We're here to help you guys out. Again, remember, Happy is a customizable formula. So if there's any issues, reach out to us and we're going to fix it for you guys. Again, thank you so much to Evelyn, who basically types all the questions, and Eric, our VP of operations. We're going to have we don't have an AMA next week, unfortunately. I'm not here. I'm on vacation that day, but we will be here the following week. Basically for another set of AMAs. Thank you so much. Have a beautiful day. Bye, everyone.